Okay with that?
Perfect. Yeah, lovely.
Okay. Díomh agus tá fearfáilte romh ar maidin. Lá bra fluc agus goifar an sa gurkig. So good morning, and you're very welcome to a virtual, very wet and windy Cork City this morning, Monday morning, but you're all very welcome. Welcome to this first of 3 workshops related to the Horizon Europe funded Senior Eco-Nect project. I'm Helen McGurk. I am head of the Hinks Centre for Entrepreneurship Excellence. And we are part of the School of Business at Munster Technological University, which is a university in the southwest of Ireland. Our research group supports entrepreneurship in all its forms, through research, through education and training. And we are a small team, but certainly a dynamic team. The Hinks are project partners on this project, and our team is led by Sarah Davis here on the screen, and Aisling Conway Lenihan unfortunately is not here this morning because she has a lecture. As they say, the day job gets in the way sometimes. This is a 2-year, very interesting project, and I hope you learn a little bit more for those of you that are new to this, and we do have some partners, but most of this group are colleagues from MTU and across the sector. So before I explain the purpose and the structure of this short session, as I said earlier, we will have you out finished by 1:30 the hour. I want to give you a brief overview of the project. So the Senior Eco-Nect, which is a Senior Economy Interconnectivity project, is charged with preparing a joint action plan to support the emergence and the development of a European ecosystem dedicated to the silver or senior aging economy, as well as ensuring the inclusivity and interconnectivity, so interconnecting between all key innovation stakeholders of the sector and across sectors. The silver economy integrates solutions targeted at older people and for their tailored supports. It can also be defined as the economic opportunities arising from the public and consumer expenditure related to an aging population, which we are very aware is certainly increasing across Europe. Now, the purpose of this morning this workshop is to explore what your vision is of the silver or the senior economy and how we can develop this sector. With the supply and demand focus, so supply of goods and services and the demand for goods and services. And how we can focus in on how policy can be developed in this key area. Inclusivity and an older person focus is the key element. So having the older person, having the person at the center of all we do. The project aims to take a bottom-up approach, again, including the older person. So we're aware of the lack of interconnectivity between, say, SMEs. So there are SMEs that work as supply goods and services, but we're looking at how we interconnect all these and how policy can actually support this. So public policy, and that's what we're here for this morning. And, all the partners have associate partners, project partners. So our partners are from across Europe, but each of those partners, So for instance, the MTU Hinks Centre, we have associate partners, and we're absolutely thrilled to have 3 excellent associate partners. I see Lisa here from the Southern Assembly. We have Veronica Murphy from Discover Partnership, and we have Siobhan Finn, who is from the Community Enterprise Hub. She's a Community Enterprise Hub manager, which looks after over 400 hubs across Ireland. So MTU's task is around influencing policy. So that is the focus of this morning. So everything we do this morning, if you can keep in mind how we can support and influence policy, and what is that policy? We're going to first hear from Jane O'Flynn, and we're delighted to welcome Jane from the Health Innovation Hub Ireland, who will talk to us about a good practice of this interconnectivity. So Jane's specifically looking at the health, but we're looking across the board, across all sectors. Following this, we'll pose, then you have to start working. We're going to pose 2 questions in 2 breakout rooms. Always in mind about policy. So when you're listening to Jane, it's a really good example how that interconnectivity comes about. So Jane, you're very welcome. And Jane O'Flynn is manager of the Health Innovation Hub Ireland, which is based in the Medical Engineering Design and Innovation Centre at Munster Technological University. So she's one of our colleagues. She liaises with healthcare innovators, advises how they might progress their ideas for new products and services, and connects them, a big word, connects them with the healthcare, regulatory, technical, research and development expertise as appropriate. She manages projects and studies, bringing innovation into and out of the healthcare system. High, as we call it, has provided an excellent case of interconnectivity in the silver health economy, linking SMEs, entrepreneurs, hospitals, universities and older people to generate innovative products that solve real problems for older health care. Actually, it's older health and care. The excellence of this interconnectivity has been recognised as best practice in the Hinks Centre EU-funded Silver SME. So Jane was very much involved in a previous project that focuses in on the silver economy as well. We hope that some of her pointers and experience will provide hints and directions for our subsequent discussions. Prior to managing Hi, Jane worked for 4 years in the Nimbus Research Centre at MTU, leading and researching software applications, Internet of Things and data analytics projects, with a particular interest in assisted living and age-friendly applications. Jane has also worked in keeping design in Scotland, where she was part of the design team in the new Royal Infirmary Edinburgh for 3 years. Jane has studied computer science, mathematics and architecture. So Jane, tá fear fáilte rót, and I leave the floor to you.
Thank you very much, Helen. I'll just share my screen here and I'll share a few slides with you. So thank you very much, everybody. Just to introduce the Health Innovation Hub Ireland, I suppose our main focus is connecting innovation with healthcare. That's our tagline, and that's we see ourselves as that connector. Next slide. So the Health Innovation Hub Ireland was set up in, our Health Innovation Hub was set up in 2013 as an initiative really backed by 2 government departments, the Department of Business, Enterprise and Innovation and the Department of Health. There was a recognition that bringing innovation into healthcare is difficult, and both departments came together with the backing of their state bodies, with Enterprise Ireland, which looks at businesses, and the Department of Health, which looks after, or the HSE, which looks after our health services in Ireland. So for 3 years, this was a demonstrator project. UCC in Cork, University College Cork, and Cork Institute of Technology, which is now MTU, were involved as key in this demonstrator. And that on the back of the success of that 3-year demonstrator, the government decided to put out an open competition to make it fair across the country for a consortium to come together for a national health innovation hub. And the team on UCC and MTU expanded to include universities in Galway and Dublin, and they applied for that competition and were successful. So we had 5 years funding from 6 years funding from 2015 to 2021. Which was reviewed externally in last year, and we were lucky to get another 5 years of funding. So the departments came together and commissioned consultants to do an external review of us and looked at our productivity, our metrics, our impact, and decided, thankfully, to refund us for another 5 years. And we expect to be reviewed again in an interim review next year, and again, a decision made in 2026. So Health Innovation Hub Ireland is Ireland's national healthcare innovation centre and accelerates needs-led solutions to improve healthcare for all. And we are the connector, and we drive collaboration between the health services, the innovators and businesses to accelerate the delivery of new healthcare technology products and services. And we deliver a strong needs-led innovation pipeline into the Irish and global health system. So that is kind of the timeline of what has been happening in Health Innovation Hub Ireland. And I just move on now to give you sort of an overview of the island of Ireland and our reach. Our headquarters are based here in Cork in the south with UCC and MTU. And as I said, we have offices in Galway and Dublin. But interesting, through our university connections, we also are connected into the health groups in Ireland. There are 7 health groups, and we are directly connected into 3 in the South-Southwest Health Hospital Group in our part of the world here in Cork, in Dublin into the Dublin Midlands Hospital Group, and the Salta Hospital Group in the west of Ireland. So that gives us a reach across the country and direct impact into local health centres, and it gives a huge benefit to companies who are trying to get feedback or trying to pilot their innovations in healthcare settings. And we have been funded, as I said, by Enterprise Ireland, who pay my wages and other managers in the hub. But we also have healthcare staff assigned to us, dedicated times assigned to us from the HSE, which really benefits us. It means that we have colleagues in the healthcare systems that work for us. And so when we try to go and get feedback or pilot a project of a new innovation, our HIHI clinical liaison colleagues are talking directly to their own HSE colleagues, and they really become that connector for us into the system, and make those connections much easier, because as you can imagine, healthcare staff are very busy, and if they're talking to their own, they're more likely to have a positive reaction. So we kind of see ourselves sitting in this stakeholder arrangement with the Health Innovation Hub there in the middle. And I don't know if you can see my pointers, but we have the companies that come to us with their ideas. And we have healthcare staff that come to us with their ideas, and we connect these through either the companies who want to get access to the healthcare staff to get feedback, and maybe the patients to get pilots, or maybe the healthcare staff coming with their ideas, needing to advance them. We help them that, and often we can lead them back to companies to make those connections. And then on the left-hand side, we are, as I said, funded by Enterprise Ireland. and that gives us links back into our main Department of Enterprise, Trade and Employment, and the IDA, which is our foreign investment arm of enterprise, that bringing in inward investment into Ireland from companies. Enterprise Ireland looks at Indigenous companies. And then we are connected directly with the Health Service Executive, that's our National Health Service provider in Ireland, and through them to the Department of Health as well. But we also rely greatly on the academic institutions, the likes of MTU or UCC or the universities in Galway and Dublin, to give us that academic expertise, the access to their innovation centres, prototyping. So that has become really important. We are directly linked into the Health Research Board, which provides a huge expertise on the likes of medical device accreditation, and also we work closely with Science Foundation Ireland, who are one of the major funders of research in Ireland. We, as I said, have four offices in the universities in Cork, Dublin and Galway. We have a multidisciplinary team, and as you heard from my background, there wasn't really much of health in that. I come from more of a technical background, but IT and technology is hugely important in health, so that's where I bring my expertise. Also, I have a lot of expertise in project management, but the rest of the team, and luckily for me, have a huge knowledge in healthcare and in science. So we have a team of engineers, scientists, we have nurses, pharmacists, biomedical engineers. So we've got quite a broad range of staff, and that's become really important for us. The health, this is a little bit of a minefield of a diagram, but it's kind of our view of the ecosystem in Ireland in health innovation. So you have the industry, you've government agencies, you've healthcare systems, and you have academia. So we have there, similar to the previous diagram, the four main stakeholders that we have in the companies: the healthcare staff, the HSE, and Enterprise Ireland. And then from there, we reach further back out into the ecosystem to work with local enterprise offices, our technology gateway centres on the industry side. On the company side, we work with the company representative bodies, say Health Tech Ireland, the Irish Pharmaceutical Associations. We work quite closely with county councils, particularly their age-friendly programmes. In the healthcare staff area, we connect in with the Nursing Homes Ireland or the Private Nursing Homes Hospital Association, the Irish College of General Practitioners. And so all these representative groups, we can kind of connect through back to give more insight into our projects. On the healthcare side, it would be community health organisations at the local level, the primary care centres, HICWA, which is our quality assurance for health bodies, and the hospital groups. So this is kind of allows us, if a company comes to us with an idea that they want to develop, we have, through our network, access to a variety of different bodies that can support them. We view innovation on a pathway from prioritizing what are the health needs of our healthcare system, and then we look at ideation of coming up with ideas and verifying those ideas, which then need perhaps a prototype to be developed of a product or a service. Then that prototype needs to be evaluated, clinical feedback given on it. And then in health, there is often, particularly on medical devices, there is definitely a long process of developing and certifying the products to make sure that they meet all the requirements, European requirements. And once the product has been certified and ready for the market, we look at the piloting of that product to give a reference site for it, and so that the company can get further feedback and have an example of where their product has worked well. And then our aim is that it would be adopted in the Irish healthcare system. So on those steps, the ones with the little hexagons with the HIHI logo, they're the ones we're active on. They're the ones where we provide focus. And the areas where the green tiles and prototype, develop and certify, other experts in the area that we had in our previous network provide that. So the prototyping can be done in technology gateways in universities or in university research centers, for example. Developing and certifying is really quite an onerous task. The clinical research facilities are better able to provide those. So we try not to replicate what others do, but we try to provide specific feedback and expertise at these points. And we look at, say, that ideation and verification stage and the little feedback loops there. Often that is an iterative process. And so the ideas might come from either a company or for a healthcare staff member. And we help to get them to verify that idea. Does it really meet a market need? And we can point them in the direction of funding that can help them to, undertake some of those tasks. And then they go off and they further develop their idea and perhaps produce a prototype. They can come back into us again at the evaluate stage, and we're happy to provide access to clinical feedback or technical feedback on their prototype so that they can get further information before they go off on the owner's task of developing it and certifying it and spending that amount of money to know whether their idea is right. And then we get to the stage of piloting and adopting. So how do we get our projects? How do people come to us? So we kind of do it a number of different ways. We have an annual call for projects every year, either a focused and an open call for any idea. And the focus call is usually specified by the health service executive as to what they would like us to look at. We have done focus calls on chronic diseases, but we actually did 2 focus calls on aging. The last being engaging positive aging, so looking at the older person and what their needs are. And these ideas come through then from companies. One call for companies, and we have a call for healthcare staff as well. And we've just recently closed a Clinical Innovator Award. So some of the ideas of those awards would be for aging population as well. But and those calls provide a bit of publicity and a bit of attraction at the time, but we also have our innovation portal open all the time, and we review that regularly. And that is open to everybody and anybody to come with ideas. And so we don't restrict it just to the annual calls, even though that can provide a bit of publicity and a focus. We have our open portal is open all the time on our website. So in the last number of years of the hub, we have helped over 500 companies, over 120 projects, I think, at this stage. And we also provide education and diploma opportunities for healthcare staff to educate them in innovation, so that we have workshops and diplomas, and there's over hundreds of people have attended those. Our reach across the country there on the left, the blue dots are where the companies we have worked with are based. And then the green indicates where the healthcare locations that helped us with those projects with those companies. So we have, I suppose, a range across the country. And even maybe an idea of some of the projects we've worked on. There's some of the products, technologies, or services. On the left there is an innovative cast for recovery from, say, a broken arm, a removable wearable cast that somebody can use, obviously, in water or swimming or activities. The lower one on the bottom left is applying pressure bandages. If they're too tight, they're obviously not good for the person. If they're too loose, they don't provide the need. And so this is a new device that's come out of research from one of the universities to measure pressure correctly. Technologies are hugely important, whether that is tracking medical conditions, or providing connectivity from people in nursing homes with their families, or providing scheduling services and reminders for appointments. And then there are also interesting innovations around some of the services, some of the gait analysis and fall prevention technologies that are available to help to keep people more active and try and prevent falling. Oh, so I'm finished, actually. That was the end of me. So that's sort of coming back to it, the Health Innovation Hub Ireland. It's that connection between innovation and healthcare. If it was easy, we wouldn't exist. And so we use our 3,000 contacts that we have in our database from all walks of health in Ireland. And our website there is hihi.ie if you want to have a look at some of our activities. And that's my email address as well. So happy to take any questions. I will stop sharing there and I'll turn my camera back on.
Thank you, Jane,
And
very much.
The weather didn't disrupt hopefully the Wi-Fi too much. I was a bit nervous.
Thanks, Jane, very much for giving us a really excellent example of this interconnectivity, which is what we're looking at and that focus. And for us, it's around that policy thing and beyond the healthcare. So this is a really good example of the healthcare, which is well established now, particularly in the Irish sense with the HIHI. I particularly liked the ecosystem, the very busy circle.
Yeah.
And I suspect that wasn't like that in 2013. It has built up. Am I correct?
Yeah. Our connections are more, and we would and even we're kind of going beyond that now. It's probably that's a couple of years old, so that probably is well, as a year old, I think. But there are more connections made, and we're making more connections with similar bodies in Northern Ireland and across Europe.
Yeah. Thank you. But I mean, I have loads of questions, but I won't. We have plenty of interaction here. But just 2 questions, and we'll keep them tight because I know you have another something else to go to. But just is your team fully financed? And what is and how many colleagues do you have?
We're about a group about 15, but not all are full-time with us. We have a number of our HSE staff, our health staff, work half-time on frontline healthcare duties and half-time with us. So I think we have 4.5 full-time equivalents in that. And then we have 5-6 project managers. So they are funded by Enterprise Ireland, but we do expect, and we are looking at becoming more self-sustainable, and we expect the review in 2026 to look at us providing some match funding. But we do find that a lot of the companies that come to us looking for feedback from clinicians are willing to pay for that service.
Okay, so hence the financing question. It's
Yeah.
that sustainability question always appears.
Yeah.
And another question was, how do you get the healthcare staff into the first call? So how did you involve the healthcare staff? I suppose, how did you get people involved in the first instance, maybe?
Yes, well, I suppose it really helps that we have healthcare staff on the ground. We do workshops and pop-up sessions to try and get interest. We advertise. Our locations are we have locations in hospital buildings that healthcare staff can pop into, and I suppose providing the call that we have for projects, just advertising that amongst the social media channels and within the healthcare system itself. Our recent one, we had a target of 15 and we had 35 project entries. So we were quite pleased with that. So the healthcare staff see the problems and better probably than most people by living through them and come up with ideas.
Okay, yeah, thanks. Innovation comes from all quarters, and it's everybody's responsibility, I suppose, gets down to it. Yeah. Jane, thank you so much. And I hope our partners, but also colleagues and other interested people on the call will learn something from Hi. And thank you so much for your time and for your involvement in this project and our other senior economy project. So thank you. Yes, and we'll move on because I know you have to leave. And thanks again. Have a good week.
You too.
Bye.
Bye.
So as Jane is leaving there, I just want to add two very quick few sentences of other good practices of interconnectivity. Certainly not as as extensive as that slide that she showed us earlier of the ecosystem, but they're in two different parts of the country, and one is in Wicklow, which is a county next to our capital, up on the east coast, County Wicklow, and that's Beyond the Trees, Avondale, recognizing that age-friendly tourist destination. So they're the first tourist destination recognizes specifically targeting age and older people. And that is a connection with the County Council, Cuilt Ireland, which is the forestry, national forestry organisation, and the Older People's Council. So you can see that we have different stakeholders coming together. The age-friendly towns in County Cork of this area is also recognised as a good practice of connectivity, and that is between, again, the County Council working with stakeholders, the Age Council, the retailers in small towns and villages, where they provide information, awareness of the value of older people and supporting them to continue to live well at home and to continue to be consumers of goods and services. So look, there's plenty of small ideas and good practices, but what we're tasked here this morning with is asking you how this ecosystem can be developed further and how policy can support this interconnectivity. Because working together, or as MTU's motto is, succeeding together, and let's explore that. So we're going to break into two rooms where we'll pose one question in each room, and hopefully with participation from everybody in the group, approximately 7 in each group. Sarah will take notes for one and I'll take notes for another. But the questions really are to get people thinking in the first instance. And when we speak to you again in subsequent meetings and workshops, that the awareness of this need for interconnectivity will become much clearer, and hopefully that you'll be able to support us at a peer-to-peer support. So I'm just going to just pose these questions first, and then you'll see them in your breakout rooms. How do you know that the silver sector is emerging in our region? And what types of policies can support and maximize benefits of a diverse silver economy? Now, the silver economy, we heard from Sarah, or from Jane, about the health. We're talking about tourism, sport, manufacturing. There's lots of broad areas. So we're open to all ideas. Second question for the second room is, what are the current problems in linking this interconnectivity senior ecosystem outside of health in the silver economy? And again, what policies can better support a senior economic sector? So let's go into the breakout rooms, and hopefully everybody can participate. And we'll come back at in 20 minutes, which is just after 25 past the hour, and we'll sum up.